Most people don't know the difference between an ophthalmologist, an optometrist, and an optician. And if you don't know the exact differences, this could lead to problems with you ending up in a waiting room that you're not supposed to be in for the type of service that you need. So in this video, to help you from wasting time in the wrong office, we're going to tell you the differences between all three and which one you should see for which specific eye care problem. Hi, I'm Dr. Nagori. I'm a board certified ophthalmologist and a fellowship trained glaucoma specialist, and you're watching the eyefacts.com channel. In addition to talking about the different eye care specialists that can help you treat your eyes, we're also going to talk a little bit about insurance, because there are actually two types of insurances when it comes to the eyes, and this is also very confusing. So it's important to know how to use your vision to optimize your benefits. Okay, first let's talk about ophthalmologist. You're going to see two H's in this word. So an ophthalmologist goes to 4 years of college, then 4 years of medical school, and then completes a 4-year residency training. Residency training in ophthalmology usually involves learning how to do surgery, learning how to do eye lasers, and other incisional procedures, as well as medical exams, as well as eye refraction, which is giving someone the prescription that they need for their glasses or contacts. Now, after those 4 years of surgical and medical training, some ophthalmologists will also go on to complete what's called a fellowship. So I did my fellowship in something called glaucoma, which makes me a glaucoma specialist, because I did an additional year of surgical training to learn how to do different glaucoma surgeries as well as different glaucoma lasers. So when you see ophthalmologist, typically after the name you will see the letters MD, which stands for medical doctor. Now this can be confusing because there is another type of medical doctor who has also gone to medical school and also done an ophthalmology residence, and these are called osteopathic doctors, and they have the degree DO instead of MD. This is different from an optometrist who will have the degree OD. So the difference is that a DO also goes to medical school like an MD and also goes through a surgical residency. So both MDs and DOs are both physicians or medical doctors. Now, in order to become an optometrist or an OD, a person has to attend 4 years of college, and then instead of medical school, they will go on to complete 4 years of optometry school. Now let's talk about opticians. Opticians are going to be your go-to experts for your eyeglasses and contacts. This means that after an ophthalmologist or an optometrist gives you a prescription for your glasses or contacts, the optician is going to be the one who helps to fit those glasses on your face and make sure that you can actually see clearly through them. Opticians are also really good at understanding insurance and helping you figure out how to optimize the use of your benefits if you do have vision benefits. So in the United States, opticians do need a high school diploma or a GED equivalent, and then beyond that, depending on the state, they may or may not require further licensure or certification. A lot of opticians also go through apprenticeship, which means they're learning on the job as they go. So what does this mean for you? So I can tell you about many situations that I had before I became an eye doctor and didn't really understand the differences, where I would call an ophthalmologist's office wanting a contact lens prescription or a contact lens update. And now not all ophthalmologists are going to do contact lenses. On the other hand, if you call an optometry office, they will typically do contact lenses. But let's say you need a laser done after you had cataract surgery, or you need someone to manage your glaucoma. Then you're going to call an ophthalmology office. Now let's take it a step further and say you want to have a stye removed. So you will want an ophthalmologist to do this, but you have to understand that not all ophthalmologists will actually do surgery on the eyelid. So specifically, you're going to ask if that ophthalmologist actually does stye surgery. Now, if your glasses have broke, you want to call the office and see if they have an optician that can actually help you fix the glasses. This eye care professional can not only help you work with your insurance company to get a new pair, but they can also see if they can just repair it in the office so you don't have to go out and buy a new pair. If you want different examples of which type of eye care professional can help you with certain things, then I've made a general list below. But remember, this is just general, and it's always important to talk to the specific eye office that you are going to see to make sure that they actually can handle the types of needs that you have. Another really common question, which is super important, is how do I use my insurance for my eyes? Well, if you have medical insurance, you can actually see an ophthalmologist, and a lot of patients don't realize this. They think that they only have to have vision insurance in order to see an ophthalmologist. Vision insurance is actually specifically so that you can get a glasses or contacts prescription. It will also typically cover full eye exams, but you don't necessarily need to have vision to get an eye health exam. An eye health exam can actually be done by an ophthalmologist. An optometrist will almost always take vision insurance. Of course, you do have to call the office and make sure. But if you have vision insurance and you want glasses or contacts, then you can almost certainly use that in an optometry office. For an ophthalmologist, it really depends on the types of insurance they accept and the types of exams that they do. So you want to make sure that when you make the appointment, ask about what specifically you need and if that office can handle your needs. Now, many eye offices will have both optometrists and ophthalmologists and opticians. So what you may have to do is see an optometrist for one need, see an ophthalmologist for another need, and then see the optician for something else. The one big caveat to know is that if you have vision insurance and medical insurance, you cannot use those on the same day. So doctors will often have to make you come back because the insurance company will not allow doctors to bill the vision plan and the medical plan on the same day. So this does require a little extra effort from the patient if they want to take advantage of their full benefits. So when you call, you can make one appointment through your vision for your glasses and contacts needs, and then you can make one appointment through your medical to address any medical issues. Hope you found this helpful. Remember to hit like and subscribe below, and if you have any other questions, leave them in the comments and I'll try to answer them in a future video. Thanks for watching.